Hi. So I'm going to answer a couple questions that I got on Ravelry on one of the forums about the video. I just thought this would be easier than writing out a whole post. Quite frankly, I'm a better talker than I am a writer. So the first question was from someone in Germany, Miss Rain. Why a natural birth and what's the big deal? The first thing I think you need to look at is the difference between the European and American systems. And I'm going to use the term American because the Canadian and American approach to maternal care is very, very similar. Medical systems aren't similar, but the approach is very similar. Here it's primarily OBGYN. Less than 1% of babies are caught by midwives. I don't like the term delivered. Pizzas are delivered, babies are born. So they're born via midwife. There's a really high rate of epidural use, and there's a really high rate of cesarean sections. Epidural use, not anecdotally, but statistically in my city it's like 85% of all mothers get an epidural. Sometimes more depending on the hospital, but it's like 85% at one hospital, and I know it's roughly 90 at another. Cesarean section rate, there's some hospitals in the States where it's 50%. There's some hospitals in Canada where it's 50%. In my own city, there's one that is 1 in 4, so 25%. There's one that's 1 in 5, 20%, and then there's one that's 1 in 3. And so like 33%. And as reference point, the 1 in 5 is the least funded hospital. The 1 in 4 is the emergency hospital, so it's the one that deals with all the really high risk cases. And the 1 in 3 is the highest funded and has the most experienced OBGYNs and the most middle class white women having babies. So yeah, I think that's a cultural thing. I think that there's kind of two extremes that have come out in birth. One is this perception that birth is terrifying and birth is painful and birth is awful and oh my god, and let's just have a section because you know what, that's way easier. I'm sorry, this cat keeps trying to jump on my lap. The other one is that they don't want anybody there because they don't want anyone to interfere in their process, and so they are going to have a baby by themselves in their house. Like there's no medical professional there at all. I don't agree with either of those scenarios. I think they're both extremes that come out of a broken system. I think societally we're all very afraid of birth in general. If you look at TV and movies, it's all screaming women on their back, freaking out. The doctor always comes in and saves the day. On A Baby Story, it's, you know, I don't know, way more than 90% are getting drugs. Way more than 90% are dealing with like huge interventions that they need to have done lest their baby die. And it's just, the whole thing is fraught with this terror aspect. And unfortunately, a lot of that actually does happen. Now, it doesn't happen that rapidly, right? But a lot of that happens because I think that women kind of perpetuate what they don't want or what they see, right? So, like, they see this really scary event and then they perpetuate it. It happens for them. And then instead of talking about birth in normal terms, they tell all their friends and talk about it in like this, I had to get this huge needle and thank God the doctor was there. But what they're not recognizing is that if they hadn't done intervention X to begin with, chances are they wouldn't have needed that emergent procedure done to save their baby's life or to save their life. A really fabulous example of this is induction. Induction is routinely done. It's routinely done here at 9 days past your due date, which is stupid because the average first-time mother goes 9 days past her due date. The average second-time mother goes 3 days past her due date. So intervening and automatically inducing with a drug like syntocinon, which is known as Pitocin in the States, and Syntocin in UK, or maybe I have Canada and UK mixed up, but syntocinon, Syntocin, Pitocin, it's synthetic oxytocin. I mean, it's a drug that causes very frequent contractions. It causes a lot of pain because the contractions aren't gradually increasing. They're like, bang, you're in labor. And they're not always as effective. So you might be having these really painful contractions and they're not doing anything, like you're stuck. The Synto causes a lot of people to need an epidural, or vice versa, because an epidural can slow down your labor, and so they augment it with the Synto or the pit. And that, the pit, if the contractions are going a little too quickly, it can actually cause fetal distress because the baby isn't getting enough oxygen, which means that they, break your bag of water. They put an internal monitor in. They're watching everything. Like, you don't have movement. And now, oh my God, the baby's really in distress, and mom has gotten this, maternal fever from the epidural, which is very common, and then we need to go into section. And they saved the baby. They absolutely saved the baby because that baby was in severe distress. But if they hadn't had the induction to begin with, they probably wouldn't have needed to save that baby. So as far as what's the big deal, I think a lot of people are trying to normalize birth. They're trying to bring it back to a place where it's not scary and it's not an automatic terror factor, and it's a normal human process, because in a lot of countries it's viewed as a normal human process. And I think in Europe in general, it's viewed as a normal human process. My cousins in Denmark they just couldn't understand why I was so adamantly against having a baby in the hospital for my second one. Because for them, a hospital birth with their babies meant they had a midwife, they weren't high risk, they had an unmedicated birth, it was treated as a normal process, it wasn't like automatically touching. So I mean, I think it's yeah, as far as what's the big deal, I think it's a big deal because it's hard to get, and it's too bad, because I think that women should be allowed to have whatever kind of birth they want, with the caveat that they should always have a medical person there, and that elective first-time cesarean sections for women with no pre-indicative medical factors. I mean, I don't think those two things should happen, because I think they both come out of a place of fear. One is fear that, it's gonna hurt like a mother ever, and the other is a fear that you're gonna have something done to your body or to yourself that you don't want. And quite frankly, both are legitimate, but that's an extreme place of fear, and that's a shame, because there just shouldn't be that much fear surrounding a normal human process that millions and millions and millions and millions of people have done. Pam, you may not come up. Okay, so the second question was from Kate in Israel regarding minimizing the cascade of interventions. Now, I don't know what the medical system is in Israel at all, but as far as minimizing the cascade of interventions, if you're having a hospital birth with an OBGYN in the American birth system, chances are you're going to get intervened upon at some point. There are a few things you can do to fix that, or to prevent that cascade, and I'm going to actually pull open this is my doula stuff, because I'm, sorry, I gotta find one with it in it, because I was giving it to people. So, yeah, I can't find it. So there are a few things you can do. One is to ask questions a lot, because I think a lot of the time too, doctors are really stretched thin, so they might have an entire ward of 12 or 15 women who are having a baby at that moment, and they need to do rounds as well as catch babies, as well as do cesarean sections. So they literally might have like 2 minutes to come in and say something to you, and then they're like gone again. Oh my God, hiccups. So they might come in and say like, we need to break your water. And it doesn't mean we need to break your water. It means like, hey, I'm really busy and this is an option you have if you want to speed something up. And so by asking those questions, you can figure out really quickly if it's actually an emergent necessary procedure or if it's not. One is, like, you can say, hey, I don't know what my alternatives are. What are my alternatives? And they can give you alternatives. Like, the alternative might be, well, you wait. What happens if I don't do it? How long do I have to decide? You know, can I have a couple hours and see if I progress more? You know, is there a specific reason you're suggesting this? So I think that by asking those questions and by ensuring that you are very clear with your provider on what type of birth you want to have and why, it can be really, really, really beneficial to avoiding that cascade. The other thing is to pick your battles. So, I mean, a lot of women that I've helped or supported, so specifically a twin mom, really wanted to have a vaginal birth, and they were really pushing a cesarean. But she said, look, if you will let me have a vaginal birth, and I mean, they were adamantly pushing her against it, or pushing against her for it. She said, I will have the baby in the operating room, and I will have an epidural line placed so that if you need to do a section, if there's an actual medical emergency, you can do it in like 2 minutes. And they agreed to that. So she actually did end up having a vaginal birth. Now, yes, she had some interventions, but she negotiated. And I think that's also a really good idea when it comes to, you know, having this cascade stop, or being in control of the cascade. So you don't just give yourself up to science, right? Like, you're saying, no, look, this is still my birth, and I might choose to have my membranes ruptured, which is something I chose to do, but that's it. Like, I don't want anything else, and I'm still gonna ask my questions with every single intervention. So anyway, that's one way you can do it. The last question, or the last sort of comment that I've seen in the thread, is aspects of birth affecting the outcome. So, you know, does the fear response equal more pain? I don't know if it's a fear response, and I don't know if we can definitively say that. I know that in some cultures, birth is not viewed as painful. It's viewed as very intense. It's viewed as very tight or very progressing, or, you know, but it's viewed as this natural thing. It's not pain. I think more than just the whole pain versus not pain argument, it should be a pain, like a productive pain versus I'm sick pain. If we could get rid of the whole sick idea surrounding birth, like that it needs to be in a hospital, that it needs to have medical intervention, that it needs to be surrounded by all this concern, because 95% of women can have a baby without any intervention whatsoever. Statistically, roughly 5% need some sort of medical intervention, and roughly 2 to 3% need, like, surgical intervention. So I think if we can get out of that mindset that it's a pain that is unnecessary, or a pain that is unproductive, or just, you know, wrong or sick, you know, that would take it away from the fear factor. Another thing I want to address real quickly is that we don't know what that pain does. I mean, birth is in its infancy as far as really understanding the process. So when you're in pain, you release a lot of adrenaline, you release a lot of oxytocin, you release a lot of endorphins, as long as you're not terrified, I will say. And that cocktail, we don't know what it does. The rate of ADHD, the rate of autism, all these things are growing, and this social disconnect. And I really wonder if it might not have something to do with the fact that we are preventing this very normal process from happening, and we are not allowing our bodies to experience this really complex cocktail of hormones that affects you in a way that I don't think you really fully understand until it's affected you. I will tell you, I've never felt higher until after I had my daughter, and it was quite a head rush. So anyway, that's it. I have like 8 seconds. So I'm going to say goodbye, and I hope this was informative and answered questions and gave you my point of view.